And now we're in for a treat here, I think. Dr. Kate Cutitta has joined us. Catherine as her full name. Dr. Cutitta is a clinical health psychologist at the Heart Center at Texas Children's Hospital in Houston. And so she's going to talk today more about our emotional, mental health, the yips and downs. So Catherine or Kate, I'll turn it over to you.
Thank you so much, Marcia, and thank you to the SADS community for having me here today. I'm going to go ahead and share my screen here and trying to use a little bit of technology with us today since we can't be in person to try to get some interaction going. So bear with me here. Confirming that you all can see just the presentation view. Is that correct?
You're good, yes.
All right, fantastic. I'm going to be using Poll Everywhere today. For those of you who aren't familiar with it, it's a great way to have some interaction with the audience. So you can access Poll Everywhere either on the web by going to pollev.com/KC, my initials, 21, or you can simply text KC21 to the number 22333 to join. You'll get a confirmation text that you've joined our room. I have about 3 activities today that where we're going to use this Poll Everywhere and see how that goes. So I'll leave this up on the screen for just a moment so everybody can get the chance to participate.
Thank you, Kate. I love that.
We'll see how it goes. I'll give everybody just another 30 seconds or so here. All right. Well, as Marcia mentioned, I'm going to be talking about the yips and the downs with you all today. And if you had to kind of scratch your head about what does this title even mean, I'm glad, and maybe you can follow along with me and see how I pull all of this together for us. As Marcia mentioned, I am the dedicated psychologist for the Heart Center at Texas Children's Hospital. And so that means I work with children through the adult congenital population and work with a lot of SADS patients as well. And so our game plan here today is to talk a little bit about the yips, really find out what I mean by that term, discuss some of the psychological distress that may come along with a SADS condition or even being a caregiver to a child or family member with SADS. And then lastly, leave you with a 3-point game plan. You may start to see a theme here for my talk, but a 3-point game plan to manage the yips and the downs that come along with managing SADS or any medical condition for that matter. All right, so here's our first chance at interacting in a virtual world together here today. Hopefully this will show up in just a second. So what is a yip, excuse me. And again, you can text KC21 to the number 22333 to join. Once you're there, you'll give a selection, an answer selection, 1, 2, 3, or 4. So what is a yip? Is it the noise a dog makes? An athlete's performance negatively impacted by stress? This isn't a real word, or none of the above. And I'll give you all a minute or two to get some answers going. And you can give more than one answer too. I believe it should be set up that way. All right, let's see if we had any success with this. All right, great. Yes, so people caught on that you could give a couple of responses. So if you chose choice number one or two, you are correct. And we will be talking mostly about choice number two, an athlete's performance negatively impacted by stress. Thank you for your participation. Got a little bit of a delay here. All right, so what are the yips? Let's take a look at a good old Merriam-Webster dictionary definition. This is a word that describes the state of nervous tension affecting an athlete in a performance of a crucial action. And so it can be used in a sentence as someone had a bad case of the yips on short putts in the case of golfing. And I'm here to propose to you today that the term yips, while we use it in sports to describe interference of performance, we can definitely apply it to living with SADS. I want to give a couple of sports references here first, just to really drive the point home. So I want to talk a little bit about an athlete, Rick Ankiel. This is a MLB baseball player. Previously was a member of the Astros, which is the Houston baseball team. And he was also a member of the Atlanta Braves, who just defeated the Astros in the World Series. It's a sore subject, so we don't have to go into the details there. But he was a pitcher from 1999 to 2013. And what actually happened here is from 99 to about 2001, he really had a bad case of the yips. So really had a difficult time managing stress, couldn't throw a strike for anything. And so that led to a series of changes in his position and what he was doing in terms of his career. I am going to switch screens here and give a little bit of a video presentation to go along with that.
Once the Yips began to dismantle Rick Ankiel, his teammates started to avoid him.
It's just something that's not talked about. It almost feels like a curse. It's like you're trapped in a mental prison and you can't get out of it because it consumes you.
Did you feel everybody was staring at you and also wanting to keep their distance?
Yeah, absolutely. And that's the hardest part about it. It's feeling like you're alone and there's nowhere to go.
I never really understood just how deeply this was terrorizing him.
Tony La Russa was the Cardinals' manager. Did your mind tell you he really had a realistic chance of coming back?
He had already shown us this character, this toughness that he has. But what we saw was a young man that was still bothered.
Ankiel tried every Yips remedy he could find. He read self-help books and went to a sports psychologist. He did breathing and counting exercises. He was able to claw his way back to the big leagues, but he was a wreck.
I'd wake up in the middle of the night, having the nightmare that I couldn't throw a strike. I'm soaked in sweat. My heart's beating 200 miles an hour. And it's like this thing won't even leave me alone during my sleep. It came to the point where I was like, it's just not worth it.
How hard a decision was that to say, I'm done?
The hardest thing beyond going through what I went through that I've ever probably had to make. This is the thing when I was young that saved me.
All right. So as you could tell from that brief clip, Rick Ankiel really was experiencing the yips in such a severe way that even got a little bit of delay on my computer switching screen share, hang with me, that even as he switched from being a pitcher to being in the outfield, that he still was stuck. And I want to talk about at the end how we can get anybody that might be stuck in a similar situation a little bit unstuck. And so the yips are such a big part of sports, and they have different terms for each different sport. You may have heard the term the twisties over the last Olympics with Simone Biles and her choice to say, hey, I'm not in a state mentally where my body is going to do what I need it to do. There are books for how to break the Yip cycle. And so there's also some interesting clips here, and I'm going to pull up another one talking about ways that athletes have tried to cure the yips. Let's see.
One of the greatest drills to stop the over-acceleration putter yips is to take a quarter and put it on the back of the blade. And what I want you to do is to make practice swings without the quarter sliding off the back of the blade. Now, what you're going to find is if I swing this putter rapidly, all of a sudden, you can see the quarter falls off. So
now, the magic was not the quarter. The quarter didn't add anything. The quarter changed the mental game. The quarter showed the golfer what to pay attention to, rather than that hyper focus on, am I going to mess up? Is something going to go wrong? The quarter brought the attention back to the routine, the habit that the golfer has known all along. And so this is the crux of what I'm talking about, how our thoughts, our behaviors, and our emotions all interact on each other. It's the core foundation of cognitive behavioral therapy, or CBT, which is an empirically supported treatment for anxiety, depression, any kind of adjustment concerns. What we think affects how we feel and act. What we do affects how we think and feel. And what we feel affects how we think and act. And you see, the cycle lends itself very nicely to the yips and also to SADS. And as a provider, both physicians and other providers of medical care team really try to look at the patient from a biopsychosocial standpoint, meaning we look at biology, gender, disability, physical health, stress reactivity, genetic vulnerability to disease. We look at the psychosocial components, behavior, personality, attitudes and beliefs, learning, and how people cope. And also the social aspects, education, social support, family and peer relationships. And the idea of well-being is right smack dab in the center, where we have to have a good understanding and balance of each of those three core components to really be able to help the patient, but also the patient, you all may have to have a good understanding of each of those components to be able to succeed and manage SADS. Mental health is health. And I'm here to really argue that today. And I think you heard in earlier sessions how really a lot of this is a mind game, and figuring out how to not hyper focus on symptoms or under focus on symptoms, but really find that balance. You can get genetic testing results, take all of your medications, attend all of your medical appointments. But if we're neglecting some aspect of social or psychological need, the whole person care just isn't there. And looking at data across all cardiac populations, there is about one in 4 heart patients report some aspects of psychological distress, anxiety, depression, any number of things.
Kate, you want to move back into show mode?
Oh, I'm sorry. Thank you.
Your bet.
Let's see. It was looking like that for me. Are we there?
There you are. Yes.
Okay.
Thanks.
Thank you for telling me. See, switching too many screens here, it comes with some
Yes,
hazards.
that's when it happened.
All right, are we still good?
All good. Go ahead.
Okay, great. So 1 in 4 heart patients report some form of psychological distress. And in particular, looking at the ICD population, now I know not everybody that I'm talking to today has an ICD or an implantable cardioverter defibrillator, but the data that we get from this group, I think, can some meta-analyses of the types of distress reported in the ICD population. We can see depression rates up to 40%. PTSD at 20%, generalized anxiety. So anxiety about a lot of factors, around 13 to 38%. And then specifically shock anxiety or fear of shock, that can go upwards of 44%. Avoidance of activity, somewhere between 33% and 84%. What a huge range. And also feeling like there's a poor understanding, or maybe even some feelings of not trusting or recognizing the device as a tool, as a helpful tool. So these components are huge. Perception is so big in how we behave, how we act, right? Going back to how our thoughts impact our behavior. And each of these things have such long-lasting and adverse impact on physical activity, patient-reported quality of life, and shock anxiety or fear of an event. Maybe we can generalize it that way. From similar studies of ICD patient distress, we see that shock anxiety or fear of shock is also correlated with poor understanding, or we can call that maybe poor confidence in device, anxiety symptoms, lower perceived support from the healthcare team, and also negative attitudes towards the device. Feeling like it's a burden or it's something that's always there, bothering you, hanging around, and more of a negative than it is a positive. Thoughts impact our feelings and behaviors. So I want to talk to you a little bit about device complications, and I don't necessarily mean the ones that you would go talk to your electrophysiologist about. I mean the ones that come along with psychological distress. So patients younger than 50 years are at greater risk for poor psychological outcomes. We know this from the data. We also know that patients that are greater than or equal to 13 years of age also report higher anxiety compared to same-aged peers. And back to that 84% or almost 85% of pediatric device patients report avoiding activities, things, or places post-ICD implant. Time and time again, across all of these studies, female patients report greater amounts of anxiety compared to their male peers. Looking at a cardiac inherited arrhythmia study out of New Zealand, looking at long QT patients in particular, asking about their own perception of risk of a sudden cardiac arrest or sudden cardiac event. The patients reported their risk of event on any given day to be about 14%. So from 0, meaning no risk at all, to 100%, meaning there will definitely be an event today or any day, 14%. While their physicians on average reported the risk to be about 4.5%. Look at that difference. There's a patient report and patient perception is that the risk is about 3 times greater than what their physician thinks and their physician has estimated. And why is this important, the perception of risk? Because the perception of risk determines our behavior. It determines how we function on a day-to-day basis. So only about 30% of those long QT patients had an accurate reporting or had a risk that was pretty on par with what the medical data would suggest and the physician would suggest. Well, 14% underestimated their risk. So they were out doing things that may not have been medically recommended or supported. But the biggest piece of the pie here is that 56% overestimated their risk. That means 56% of people were thinking and behaving in a way that was protecting them, maybe unnecessarily. So maybe taking their life and their experiences from something that's this big to something that's much more narrow. So patient risk perceptions correlate poorly with clinician risk perception. Okay, and the idea that has been discussed, that was discussed yesterday and today about shared decision making related to sports in particular and exercise is really important. So having those conversations with your provider to make sure you're in that 30% more accurate perception of risk group. And you're probably already taking strides to do that. You're here today at a conference, learning more, taking in everything that all of the experts from yesterday and today have added. So bringing it back to the Yip cycle, a typical Yip cycle in golf might look like this: having a poor chipper putt, the Yip, then having the thought, what's wrong with my chipping and putting? I better change something and focus on it. Then having another poor chipper putt, which might lead to increased anxiety, performance anxiety. I'm losing control. It's so embarrassing and frustrating. What's next? Which might then come with over control or hypervigilance of the swing and stroke and focus, so intense focus, which might lead to another poor chipper putt. And the thoughts, what's wrong with my body? And how this is really an unbalanced view, so much so that we're kind of disrupting this golfer's whole practice. This might be an example of a Yip cycle in the SADS population. So having a PVC or heart rate increase while doing any activity here might lead to anxiety, might lead to avoidance of that activity because, hey, nobody really likes the way that anxiety feels or having thoughts about, is my heart okay? Am I okay to continue going on? After avoiding activity, we might engage in more efforts to control or over control the body and life, really paying attention to that swing, and then become less engaged in things. So again, taking life and all of the things that you do from this to more narrowed and focus in. And you can see this is just a cycle and it keeps going. We're humans. We tend to pair feelings, behaviors, and events together to make better sense of our world. And so this is why it's so important to be able to recognize what's going on for you in your body and knowing what to call it. Differentiating between anxiety and a symptom that might need medical attention. It's not easy, it takes practice. The other component of this cycle is the down part of the yips and downs. Once you go through an anxiety cycle and get stuck in an anxiety cycle like this for so long, it can lead to symptoms of depression, which makes you even less engaged in life. And so now you're withdrawn, not engaging in the things that you used to enjoy, and really not doing as much as you used to. So after seeing all of those self-help books for breaking the Yip cycle in sports, I want to propose that we're kind of making a self-help book of breaking the yips in the SADS population. So strategies to live with SADS confidently. If you take all of the information that you've learned over the course of this weekend, from your notes, from all of the speakers, you've probably built this book. And it's important. It's important to reference because having a game plan for when the yips come up is exactly how we manage it. We do things like fire drills at work or at school to have a better understanding of where your body should go and what you should do in the event of a situation. Same thing works for anxiety and psychological distress. If we have a coping plan and a way to attack it, if we sense something coming on, we're feeling a lot more confident, saying, come on, world, bring it on. I'm ready to take anything on. And so getting to my 3-point plan here, I want to first cover sleep quality, then talk a little bit about stress management, and then lastly, re-engaging in life. Now, what I'm about to say is by no means exhaustive. I could talk about each of these topics for a whole session in and of themselves, and I'm happy to answer questions at the end. But when we're thinking about the definition of the yips, these are the crucial actions that need to be performed, and not just by athletes, but also by each and every one of us with a SADS condition, being a caregiver of somebody with a SADS condition, anybody. So I think there was some mention during the fireside chat about sleep, and in particular, sleep quality, and that was so right on. We have two things that we think about when we think about sleep. We think about quality and quantity. Most of us can figure out whether we're getting quantity, how many hours you're in bed or what time you try to go to bed and what time your alarm goes off in the morning. But what happens in the middle is really where the important stuff is. Is it quality sleep? Are you asleep the whole time and staying asleep? Are you waking up and looking at your phone, checking work email, hearing noises in the middle of the night? Sleep is so important because it actually impacts how emotion regulation goes during the daytime and how emotional or keyed up we might be at the end of the day impacts how our sleep goes. So we have another cycle here, and you're probably starting to get the sense that a lot that happens psychologically is a bit of a cycle. And so figuring out where to break that cycle is most important. Thinking about stress management, ways that you can develop coping skills, coping tools to have in your toolbox ready to go, have that backup plan for how to manage stress is incredibly important. There are many, many, many resources on the internet to think about ways to manage stress. But if you just think about the things that you like to do, that you feel calm doing, that's relaxing for you, that's probably a way that you manage stress. Remember the data and perception of risk? Most of us underrate our ability to cope and overrate the impact of our problems. So you probably already have a toolbox of things that you enjoy, things that might bring your breathing down a little bit, bring your heart rate down a little bit, stop all of the worry thoughts that are happening in your head. Write those things down so the next time you're feeling overwhelmed or stressed, you have a go-to. For a lot of people these days in the pandemic world, it's been important to rely on those coping techniques. I also have medicine and pill boxes up here, which might seem a little bit funny. What does that have to do with stress management? I'm a huge advocate of using electronic devices and other organizational devices to help with medication management. Anything you can do to remove some of the thinking out of managing SADS will help manage stress. So if medication is happening out of your pill box, maybe you can take some thinking out of it and put the medication in a pill organizer, right? Or using alarms. Those are ways that we can manage stress that aren't necessarily practicing yoga or reading a book or taking a bath. Lastly, and most importantly, re-engaging in life, adding pleasant activities, making small changes to your day that might add a little bit of joy in your life. It might include adding other people in an activity that you're already doing. That might bring some joy. And also gratitude, thinking about gratitude. And I'll get into that in a little bit. But small changes over time allow you to have more symptoms of life and less symptoms of stress. Martin Seligman, who's a positive psychologist, once said that happiness is a choice and optimism is learned. And so we can figure out how to teach ourselves optimism by engaging in some of these practices. Gratitude actually has long-lasting effects on the brain. There are some fMRI studies where people were asked to write a gratitude letter and a control group did not. The folks that were asked to write the gratitude letter actually showed greater activation in their prefrontal cortex area. And that's the part of your brain that's considered to be the emotional control center. It's where emotion regulation happens, among other things like executive functioning, decision making. It's a really important part of the brain. And those effects were found about 3 months after the actual activity of writing a gratitude letter. So what does that even mean, having a gratitude? That just means finding something that you're thankful for. It can be a small thing. It doesn't have to be very big. Some days you might find that you're thankful for opening a new jar of peanut butter. That just might be the most wonderful thing that day. That's okay. And some days it might be your commute to work was actually pretty smooth. That's okay to be grateful for. Focusing on those things helps provide some of that balance to the other hard things that happen in life. And as humans, we try to make sense of the world around us by organizing it. Like I mentioned before, we put symptoms into buckets and call them syndromes and disorders. And oftentimes it's helpful to name what's going on so we know the signs and symptoms and how to respond, when to engage that coping kit. So what I'm proposing is that we might come up with a name for the cardiac yips. Those times when you're feeling off, having a difficult time with medicine, being engaged in life, or sleeping, or feeling nervous about exercising, despite conversations with your doctor. So we're going to do that on the next slide here. I want to also suggest that wording is a crucial piece of adjustment to life with SADS. We heard Mikhail's story earlier, and she mentioned her shift in thinking about her ICD and SCAR, the shift from survivor to thriver, and the focus from the SCAR to being a medal of honor. Our thoughts and behaviors are imperative in defeating the cardiac yips. So if you remember if you were already texting to get into the poll everywhere, you can go ahead and enter a name that you might want to call the cardiac yips. I'll give it a little while to see if we have anybody with a good idea or something that you might want to call it. You might want to refer to it in your own house, just when you're having an off day. Any brave volunteers? And yeah, I think you can enter multiple suggestions. The beats, I love it. That's fantastic. That's a great one. The upbeats. All right. So you're kind of coming at it saying, all right, we got to figure out how to get the upbeats going. All right. The bios. I know sometimes it's hard to be interactive on these virtual environments. I really appreciate it though. Any others out there? Oh, getting a few more. Might have had an autocorrect in there. The bips. I see. Okay, so bios maybe was bips. All right. Continue to think about it. Maybe there's a term that you want to use in your house to just say, like, we got to figure out our game plan. We got to use our coping strategies. And lastly, since there is some research behind gratitude and we're so close to Thanksgiving, for those of us who celebrate Thanksgiving, maybe we can think about one small thing that you're grateful for today. If you're wanting to share that, that will probably scroll up on the screen. But again, it can be as small as having a new jar of peanut butter, a new tube of toothpaste, to whatever the weather might look like in your neck of the woods today. Having just enough milk to enjoy your coffee this morning. Any takers? Might feel compelled to start saying Bueller. Bueller. All right, we can skip over that one. Maybe think about it. So I want to say thank you for letting me be a part of this conference today. And I hope you were able to take home some of nuggets from what I talked about. Your doctors, your medical care team does the best to mitigate risk and to put safety nets in place and to have a care plan in place. And you understand your thoughts, feelings, and behaviors and how they all connect. So you're your own expert and what you bring to the table. And so continue to have those open conversations with your support system and your medical providers, and keep identifying the beats when they happen, or the bips, or whatever you choose to call them, and know how to respond.